When you hear the term home health care, what comes to mind? A nurse at the bedside of someone critically ill? Expensive care that only wealthy people can afford? The truth is, home health care is far more accessible, flexible, and empowering than most people realize. Today, we're going to break down exactly what home health care is, how it differs from other types of care, and debunk some of the most common myths that might be keeping you, or someone you love, from getting the support they need. 1. What is home health care? Let's start with the basics. Home health care refers to medical care provided in the comfort of your own home by licensed professionals, typically nurses, physical therapists, or certified aides. It's designed for people who may be recovering from illness or surgery, living with chronic conditions, or needing medical support to remain independent at home. This isn't just a luxury service. It's a medically prescribed and regulated form of care that can include wound care injections or IV therapy, monitoring vitals or chronic conditions, medication management, physical, occupational, or speech therapy, patient and caregiver education. The goal? To help you recover faster, stay healthier, and live more comfortably. Right where you belong, at home. 2. Home health care versus hospice or non-medical home care. Here's where people often get confused. So let's clear it up. Home health care is medical in nature. It's prescribed by a doctor, covered by Medicare and most private insurance plans, and focused on recovery or stabilization. It's short-term, goal-oriented care, not end-of-life care. Hospice care, on the other hand, is for individuals facing terminal illness, often in the last 6 months of life. Hospice is focused on comfort, not cure. Non-medical home care provides help with daily activities like bathing, dressing, meal prep, or companionship. It's not usually covered by insurance and is not provided by licensed medical professionals. Home health care sits in the middle. It's skilled care to support healing, independence, and dignity. Myth 1. Home health care is only for the very sick. This is one of the most common misconceptions. Home health care isn't just for people who are critically ill or bedridden. In fact, many patients receive short-term care after a hospital stay, a fall or injury, starting a new medication, a joint replacement or surgery, a change in their condition. Some may need physical therapy to regain strength. Others may need a nurse to help manage a new diagnosis like diabetes or COPD. Home health care is for anyone who wants to heal, stay safe, or manage a health condition without going back to the hospital. Myth 2. It's too expensive. Here's the good news. Home health care is typically covered by Medicare, Medicaid, and most private insurance plans. If your doctor recommends it and you meet basic criteria, like being homebound or needing skilled care, insurance will usually cover the costs. In fact, home health care is often more affordable than extended hospital stays or long-term facility care. Plus, you're not just saving money, you're gaining the comfort, privacy, and personalized attention that only home can provide. 3. Who benefits most from home health care? Home health care can be life-changing for older adults recovering from surgery, individuals managing chronic illnesses like diabetes, heart disease, or stroke, those transitioning from hospital to home after an injury, people who want to avoid institutional care but still need medical support. It also brings peace of mind to family members, knowing their loved one is being cared for by skilled professionals, without the stress of travel or unfamiliar facilities. At Heart of the Rockies Home Health Care, we meet you where you are, literally, and walk with you toward better health. 4. The natural wellness perspective. Home health care doesn't just address medical needs, it also supports your whole wellness. We believe healing happens faster when you're surrounded by loved ones, following a personalized plan, able to move, rest, and eat on your own schedule. And when natural wellness is part of that plan, like nutritious meals, stress reduction, movement, and herbal support, outcomes improve even more. At Heart of the Rockies Home Health Care, we integrate natural and practical tools that help you heal holistically. Home health care isn't just for the sick, the wealthy, or the elderly. It's for anyone who wants healing with dignity, support with compassion, and the comfort of recovering in the place that feels most like you. Home. What questions do you have about home healthcare? Drop them in the comments. We'd love to help. Like this video if you found it helpful, and subscribe for more insight from Heart of the Rockies Home Healthcare, where healing begins at home.